So first thing that we're going to do is we're going to find ideal positioning.
Okay.
Heels, knees, sit bones lined up. Then you're going to tilt the pelvis backwards and forwards. So go ahead and do that. And you're going to do that 3 times. And then you're going to find what you feel is the middle of that motion. Okay. Then hands at your sides. Think about making shoulders nice and wide. And then back of the neck nice and long. Kind of yeah, like that. Where you're kind of tucking the chin a little bit. Okay, so that's the alignment. Mm-hmm. And we want you to do that over and over and over again. If you got a wall to put your back against, you do it against a wall. If you're crawling on the ground and you got room, roll onto your back. Do it, do it. And the more often that you do it and find that, the better you're going to stay in that and the healthier the spine's going to get.
Gotcha.
So at least once per hour during your workday, you should be making this alignment connection. Okay. So now the powerhouse. It's breath into the nose, out through the mouth, through pursed lips and tongue. It's going to look and sound like this. Shh. Can you show me? So as long as you feel like you're resisting the air going out, that's great. Okay. Now, abdominal muscles, 3 layers. We got rectus abdominis, the 6-pack muscle, the abdominal obliques named because they're going obliquely on the lower belly, and then one we're concerned about right now, the transverse abdominis. And what the transverse abdominis does is it pulls the lower belly back towards the spine. You take 2 fingers here, find the pointy hip bone, and then roll just to the inside. Take a breath in, and then draw the lower belly in towards the spine. And you should feel all that nice engagement. Awesome. Then pelvic floor muscles. Pelvic floor sits here. Urethra, what we pee through. Anus, what we poop through. Both pass through that muscle. When you contract that muscle, it moves up towards your head. 2 cues to help people get to know that they are contracting their pelvic floor is if they stop a pee in the middle of peeing, but we don't want people to do that on a regular basis because that does promote urinary tract infections. And the other one is holding in a fart. So let's combine all 3 of those things. So it's breath in, breathe out, engage, shh, lift the pelvic floor, draw it. You feel all that nice turn on. That action of lifting the pelvic floor part is what turns on the deep spinal stabilization muscles. We can't feel those muscles, but we know that when the pelvic floor gets lifted, those guys are on. So it's a really important sensation to get. So now what you're going to do, it's going to be breath in, breathe out, give yourself about a second, and then the leg's going to go from where it is to tabletop. So it's going to look like this. Can you show me?
So one leg up?
One leg up, yep. And you want to have engagement for a full second before you move. Good, awesome. Try and make more of a shh sound, like you're telling someone to be quiet. Yep, okay. That looks good. And what we want is for that not to be any motion in the spine there. You're keeping yourself in that neutral position. That looks good. Yeah. This one is simple. Is that the friction of the added rope makes it so you don't have to work as hard, and that's what we want. And you see how your elbows are bent so much?
Yeah.
Focus on that. There we go. We don't want that either. So let me tighten this guy. Try again. You want to have a little bend in the elbow just so you don't have to work that hard, because in general you want to try and relax when you do this. Knee straight and head down. So this becomes your position. You want to feel a comfortable stretch here. If you feel too much stretch, you can let it down a little bit.
Okay.
If your back is more irritated, in general, you're going to have more tightness. Honor the tightness.
Okay.
Don't push. Then you're going to stay here for 16 full breaths, which is a minute. Then you're going to take the strap, put it all in that hand. But you wrap it around the hand just like, so you have that. Good. And then you're going to let the leg come down a little bit and then out to the side. And what's important here is that hip needs to stay down. This leg should also be straight. During the whole thing, it should have been straight. So you let the leg come out and then you pull up here. So now you're stretching the inside part of the hamstring.
Okay.
And you play with the adjustment of the rope too. Right. Don't you because you're bent a lot there. When I do this, I have a coffee table, and I let my leg rest on the coffee table and pull up so I can really relax. Does that make sense? Because I'm laying next to the coffee table stretching.
So then you're supporting it this way.
I'm supporting it on the outside. So imagine I'm the coffee table.
Yeah.
So you're here, and that way you pull it up, and it's just letting you relax more.
Gotcha. Okay.
Then the stretch here, you switch hands again, and the leg comes across and then up. And generally, this is the most intense of the stretches. Okay? And again, 16 full breaths in each of these different positions.
Okay.
Since the right leg is a little bit tighter, you can go a little bit longer on the right side. Try and you can try and balance yourself out.
Gotcha.
And so that is your position. And what you want is so the legs are both going to be straight and the feet are pointing straight. And if you want to feel that comfortable stretch again, you don't feel enough stretch, you scoot closer. Okay. You feel too much stretch, you scoot that way.